Okay, is it showing? So we start with a case of your vaginal infection. Okay, so at the OPD, you see a 28-year-old naligravid complaining of vaginal discharge. So what are the important things that you will have to elicit regarding this patient's history? Okay, one by one. Amit,
Dog symptoms like itching or painful urination.
okay, you look at if it is pruritic. You look at dysuria. Okay, Rushi,
Doc, we will ask if the patient is sexually active and the symptoms like dyspareunia, and when
if
did
the
the sim
patient, okay, one by one. Patient is sexually active or
and,
if there is painful intercourse. Okay, what else?
and
Devika,
Ma'am, we will ask for last menstrual period.
we will ask for last menstrual period. What else? Nitish,
Doc, we will ask for consistency like watery discharge and mucus or bloody or not.
okay, we characterize the discharge. How else? How do we characterize the discharge? If it's bloody, it's mucoid. What else? Padinjarakutu. Padinjarikutu.
Yes, ma'am. Is there any smell in the discharge? And
If it's foul smelling, okay, that's good.
yeah,
What else? Wait,
and we can
some
ask
other, some
about her.
other.
Okay.
Himanshu,
Color of discharge.
color of discharge. Nayak,
Any medications, if she's on any medications like
any
antibiotics or
medications taken, specifically antibiotics. Okay. Jacob, patsayapan. Patsayapan.
Yes, so if it is purities, whether she has any itching or color of the discharge,
Already given, pruritic. What else could you think of?
whether it's thick or watery, whether the discharge
What are
and
it's, if it's watery or what's the other one?
thick,
Thick,
thick, yes, doc.
thick and curdy. That's what how they
Bloody,
usually describe. Okay.
yes, doc.
Het Kumar Patel.
Yes, Pudok. Is there any patient having any sexual partners?
Okay, sexual partners.
Yes.
Chirag,
Ask about previous history of discharge.
if there is previous history of discharge. Okay. Pandia,
Ask if a patient is a smoker or drinking any alcoholic beverages.
smoker or alcoholic beverage drinker. Harsh,
Doc, we will ask for associated symptoms like fever or any kind of pain.
associated symptoms such as fever or pain. Parik,
We can ask about the amount of the discharge.
amount of discharge. Okay. Nagineni,
We can ask for personal hygiene practices like douching.
personal hygiene. Douching is one. Wearing cotton underwear is one. Okay. Last, J. Are you happy with the patient's history and the questions that you have asked so far?
Yes, ma'am.
What are your differentials then at this point?
Ma'am, bacterial infection.
You are thinking of bacterial infection or you're
Yes.
thinking of particularly where? Anyone who would want to improve Jay's diagnosis?
Doc, bacterial
Bacterial
vaginosis.
vaginosis.
Okay, or you could say vulvo vaginal vaginosis if you are not sure of the etiology yet, because you are not sure if this is indeed bacterial. Okay. What are your differentials? Your primary working impression would be vulvovaginal vaginosis. What are your differentials for this
Trichomonas.
vaginosis? One is trichomonas. When will you say that it is trichomonas? What are the characteristics of a trichomonas infection?
Ma'am, it shows strawberry
Prur-
cervix and frothy and yellow-green foul-smelling discharge.
Okay? You
Pruritus
have is it mainly pruritic?
and dyspareunia for the trichomonas.
Would it be pruritic? Some will not be pruritic. Your pruritus would be more prominent in the other candidiasis. So, green, frothy discharge. What else?
More than
Foul smelling?
4.5 pH.
Foul smelling.
And also,
You
doc,
have your pH.
strawberry
Strawberry
cervix.
cervix. Okay, those are the things that you will anticipate. What are your other differentials?
Candidiasis, ma'am.
Candidiasis. How will you characterize your vaginal candidiasis?
The
White
discharge
discharge.
is discharge in candidiasis is curdy white or cottage cheese like.
Okay. What else?
There is a dyspareunia, dysuria, and there is a pruritus.
Okay. Pruritic, cottage cheese like. Those are buzzwords for vaginal candidiasis. Okay. What are your other differentials?
STD. It could be STD like Neisseria or
It could be sexually transmitted
chlamydia.
infections like. What are the
Gon-
two most common?
Gonorrhea and chlamydia po.
So you have your gonorrhea and your chlamydia. How will you differentiate or clinch the diagnosis of your gonorrhea or your
Gonorrhea on
chlamydia?
microscopy, but it will look like diplococci.
Diplococci, could you describe it further? What's the characteristic description of your gonorrhea?
Ground glass appearance.
Gram
Gram negative.
gram negative.
And we can see the polymorphonuclear cells inside the cell.
Okay. Gram negative diplococci that you will see on gram stain. What else? So you
Ma'am,
have your
it's not
trichomonas, you have your fungal, you have your chlamydia, your gonorrhea, pyric.
Ma'am, gonorrhea does not have a polysaccharide capsule. To ask for the difference.
Yes, your differentials. What else? So if you know more or less discharge, you think a lot of things, but these are the most common ones. Okay? And you will target your physical examination so that you could distinguish one from the other so that you will arrive at the correct treatment. Okay. So this is what she answers you. Could you read? Okay, so she describes the discharge as a yellowish, foul-smelling discharge, and it is pruritic. Okay, she mentions that washing with lukewarm to hot water relieves itchiness for a while but comes back after 1 to 2 hours. She works at a call center and has had 4 sexual partners within the past year. So what's your primary working impression? We went ahead of our slides. And what are the things that you would look for in your physical examination? Okay, so you have mentioned vulvovaginal candidiasis, and then you enumerated the different etiologies for vaginal candidiasis. So, other systems normal on speculum exam, this it shows this. What is this called?
Strawberry.
Strawberry
Strawberry
cervix.
cervix.
Strawberry vagina.
So, this is strawberry cervix, which is pathognomonic of what?
Trichomonas.
Trichomonas.
Right? It's pathognomonic of your trichomonas infection. Okay. Although, well, it's not always the case. Sometimes there's discharge, but there is no strawberry cervix. I think I have just seen it once in my OBGYN career. Okay. So internal examination showed labia with excoriations, note of discharge with a fishy odor, cervix is closed, corpus is small, no mass and tenderness. So then, now what is your primary working impression? And what are the diagnostics that will help you clinch your diagnosis? Sorry, I clicked it. Okay. So what's your primary working impression given this information?
Maybe the patient have associated bacterial vaginosis.
Okay. Who's talking? Your bandwidth is not good. So you have your bacterial vaginosis. So what are the diagnostics that will help you? What are the diagnostics that you will request?
For the wet mount, for the
Okay, wet
clue
mount.
cells.
So how will you do your wet mount? What are the slides that you have to prepare? Himanshu. Himanshu.
Yes, ma'am.
What are the slides that you have to prepare for your wet mount?
This slides for wet mount.
What are the slides? How will you prepare the slides for your wet mount?
Potassium hydroxide.
KOH, and that will be indicative of what? What will turn out if you put potassium hydroxide in your um in on your slides?
Off-white gray color discharge, and no, those are the
And
characteristics.
that will
Then
show you
more than
what?
it will show us that it is bacterial vaginosis. More than
No,
4.5 years.
KOH. You place KOH. What
Okay,
will turn out?
it will give fishy odor.
Wait, you're getting confused. If you put KOH on your slide, what will happen? What will you see?
It will be positive whiff test.
You are not answering my question. If you put KOH on your wet mount, what
Yes.
will you see?
Clue cells.
Nagineni, do you have another answer?
Doc, upon adding KOH, we can the smell could be like ammonia, and there could be clue cells like which is associated with bacterial load.
Do you agree, Rushi?
If it's bacterial vaginosis, I agree that we can see clue cells on the slide doc.
My question is, if you put KOH on your wet mount, what will you see?
I am not sure of that, doctor.
Okay, anyone who knows the answer?
Yeast cells.
Who, who's that? Nayak?
Yes, ma'am.
Okay. When you put KOH, you see your yeast cells or you see your hyphal elements. Okay. And that is indicative of what?
Candidiasis
Candidiasis.
photo.
Candidiasis.
Okay. So that is indicative of your vaginal candidiasis. Okay. So that's your first mount. What else would you do to your mount so that you could differentiate other candidiasis? There you go with your whiff test and your microscopy, which will show you what? Then you answer your clue cells. Okay. Then you answer your whiff test. This is what criteria. Then you look for the pH.
Amsler criteria.
Amsels criteria.
So this is your AMSELS criteria. Okay. What else will help you? You have your wet mount. Okay. What else would help you? You have mentioned your chlamydia and gonorrhea. How would you clinch the diagnosis of your chlamydia and gonorrhea? Pyric,
NAC test.
what test will yield you your gram-negative diplococci?
gram staining po.
Okay, you request for a gram stain, vaginal gram stain, so that you could see if there's gonorrhea in your patient. Okay, and that will direct you on what is most probably the etiologic agent of your infection. So what is this? This is the normal.
First,
And what is this? And this is a gram stain. So the what's this?
Is this clue cells po?
So these are your clue cells with increased uptake in your okay. pH is 5. So what is your diagnosis and what is your basis?
Bacterial vaginosis po. If pH is 5. It should be more than 4.5 according to Amsler's
Okay.
criteria po.
So what is your recommended treatment?
Metronidazole.
Metronidazole?
400
Pharmacologic.
mg.
What's your non-pharmacologic? What are your non-pharmacologic interventions?
Doc, as the patient has increased sexual partners, we will advise the patient to have a safe and protected sex.
Okay, what else?
Since she had multiple sexual partners, she should be tested for STDs, like other STDs.
Okay, we test for other STDs. What else?
Alcohol and smoking should be avoided.
What?
Alcohol and smoking should be avoided.
Okay. That's mainly for non-pharmacologic hygiene. What else?
Avoid
Cotton
douching.
underwear. Avoid.
Douching.
Avoid douching. Okay. Okay. I'm sorry I haven't updated this, but I think for DV it's still the same. But I will still cross-check it. I will send also to your LO because CDC has just released a 2021 CDC guideline for sexually transmitted infection, and that includes your bacterial vaginosis. Okay, but of course, your bacterial vaginosis central treatment would be your metronidazole given 500 milligram orally twice a day, as you have mentioned. Other options would be your metro or your Clinda cream, although that is more expensive. So we take the tablet because that's more affordable for your patients. Okay? Suffice it to say, you see, trichomonas, but it's pruritic, etc., etc. Okay? My take-home message for vaginal infections is that there would be general presentations, but most often, sometimes it occurs together. Okay? There's concomitant candidiasis, there's concomitant trichomonas, there's also gonorrhea. Sometimes it will not occur alone. As you have encountered in your other clinical rotations, your body is not an island. So you cannot say, oh, it's just a reproductive problem. When you're at the ER, someone's complaining of abdominal pain, surgery should be involved, OB should be involved, medicine should be involved because it involves all the disciplines. So when you look at the patient, you do not think of it as, oh, I'm in obstetrics rotation. This should be the problem. Of course, it involves a lot of disciplines. That's why you have to be, at least when you graduate your as medical doctors, you have to be adept in all of them, and then you specialize. Okay. Any questions for vaginal infections? Fairly simple topic. Okay. So if there are no more questions, you may leave this call. Have a good day. Stay safe. Picture, please. Please open your cameras. I've almost forgot. Okay. Could someone, Amit, could you?
Yes, Padok, I'm taking.
And then send to my Viber, please.
Done, Padok.
All right. Goodbye. Have a good day. See you next